is Dr. Dunn. I'm a surgeon in the San Francisco Bay Area specializing in the esophagus and the stomach. And today we're going to talk about hiatal hernias. So we're going to cover what is a hiatal hernia, what are the common symptoms, what are the risk factors, how do you diagnose it, and how do you treat it. So first, to understand what a hiatal hernia is, we have to understand the normal anatomy of your body in this area. So we all have a chest and a belly, and then in between the chest and the belly is the diaphragm muscle, and that is the dividing line, and it helps you to breathe. So when it contracts, it moves down, and when it relaxes, it moves up, and your lungs expand, your belly gets smaller, and it goes back and forth all day like this. Now, we have the esophagus, which is the food pipe. You swallow, and the esophagus takes the food through your chest, and then it goes into your belly and meets up with the stomach. So there is a natural hole in that diaphragm muscle to allow the esophagus to connect between the chest to the belly and bring the food down. If the hole didn't exist, then there would be no way to get food into your stomach. So we all have this natural hole called the esophageal hiatus. And when that hole gets too big, then things can actually push up from your belly into your chest, and that can cause symptoms. And that's what a hiatal hernia is the part of the stomach is up into your chest. So what are the symptoms that this can cause? So the diaphragm muscle normally protects you from acid reflux. It's part of the barrier that allows things to stay where they are supposed to be in the stomach. And when it's too loose, then you can get acid reflux. And so the symptoms of a hiatal hernia are very closely related to the symptoms of acid reflux. So what are those symptoms? Well, heartburn, burning below your breastbone, trouble swallowing, which is what we call dysphagia. There's also a word called regurgitation, meaning stuff coming up. So you swallow and you think it's going to go down, and then it comes back up into the back of your throat. It's an uncomfortable sensation. Sometimes people also feel like there's a hand on their throat. That's a little bit less common. Sometimes people have frequent asthma attacks or pneumonias because stuff is continuously coming up and getting into their windpipe, causing lung problems. And there's even something called esophageal spasms, which can feel like a heart attack. So acid goes up, hits your esophagus, and the esophagus squeezes and spasms down as a protective measure, but you feel it as chest pain. So a lot of patients will come to the emergency department and say, oh my God, I'm having a heart attack. They do a bunch of tests. They say, hey, your heart's totally fine. You go home, you're confused, you don't understand what's going on. It turns out that it was acid reflux causing an esophageal spasm. So those are the symptoms. We also should talk about the risk factors. So if you have a hiatal hernia, that can be caused by normal wear and tear from aging. So just being over the age of 50, over time, the hiatus can stretch and you can get a hiatal hernia. Also, anything that increases your belly pressure, that can cause a hiatal hernia. So if you're overweight and you have a lot of belly fat, it can push the stomach up and stretch the hiatus open and give you a hiatal hernia. Also, if you've had multiple pregnancies, that's a risk factor. And then if you do a lot of heavy weightlifting where you have to squeeze your belly down a lot, that can cause a hiatal hernia. So just like any other hernia in the abdomen or the belly area, you can get it from a lot of weightlifting or a lot of bearing down and flexing your belly muscles. Okay, so you come into the clinic or you come into the emergency department, you have these symptoms. How do we know that that's actually what it is? Because these organs are sitting right in the middle of your chest and your belly, and we can't see what's going on. So we have to do some tests. So the first test that we do is called a barium swallow. So what happens is you drink contrast, and then we shoot a series of x-ray pictures like a movie, and then we see what the esophagus looks like, what the stomach looks like, and then the relationship between everything and the diaphragm. So that's one way of telling what's going on. Another way of telling what's going on is called endoscopy. So we have a camera that's at the end of a flexible tube. We give you anesthesia, you go to sleep, and then we put the tube through your mouth and we take a bunch of pictures and we look down with the camera as we go from your esophagus to your stomach. And we can tell the relationship between the esophagus, the stomach, and the diaphragm muscles. Actually, one of the most important things to do is to take the camera and flip it up backwards and look back up from the stomach towards your chest and sort of see the relationship between everything. That can give us a lot of valuable information. We can also see if there are any tumors or any damage or erosions from acid while we're doing that test. So it does a few different things. And then the last common test which is done is a CAT scan. So I don't usually request CAT scans to find hiatal hernias because the barium swallow is a better test for it. However, if you had belly pain or some other symptom, you came to the emergency department and you just happened to get a CAT scan, sometimes if you have a large hiatal hernia, we can see it on that. So now that we understand how to diagnose it, we have to also talk about how to treat it. So if you have a small hiatal hernia where just the stomach is sliding up a few centimeters and it's causing you no symptoms, then it's safe to watch and wait. If you have acid reflux symptoms, then to treat those symptoms, you can either get on medications or change your diet, or you can consider surgery. So if you change your diet, avoiding foods like spicy foods, chocolate, coffee, those things can make the acid reflux symptoms get better. Also, medications can block the creation of acid by the stomach. And so that will, basically you can still have stuff going up and having reflux, but you don't have the symptoms because the stuff that's coming up isn't acidic. And finally, there's surgery. So these other things are sort of taking care of symptoms, but they're not actually getting to the root cause of the problem, which is that the hiatus is too big. So surgery, minimally invasive surgery, can be done in usually about an hour, and that can be used to treat the problem and put the stomach back down into the belly where it belongs, and close the opening partially in the diaphragm so that it's just the right size for the esophagus, and just repair everything. I hope that was helpful. We can talk more about different types of treatment options in my next videos. And if you have any additional questions, you can go on my website at norcalsurge.com and you can send me messages or call me there. And I'm very happy to respond. I want everyone to really understand what's going on so they are better informed so they can make good choices about their health. So please like and subscribe and reach out to me, and hopefully I'll see you guys in the next video.